Hi, I'm Daniel, and in this video, I'll be sharing insights from a qualitative study. Every day in hospitals, patients have their medications refilled, adjusted, or replaced. For many of us, these changes are just part of the process. But for older patients who may already manage several medications, each change can be confusing, even unsettling. Clear communication about why those changes happen isn't just nice to have, it's essential for understanding, safety, and trust. My research explores how older patients and their carers perceive healthcare professionals' communication about medication changes during hospital stays. Communication about medication changes is one of the most critical parts of inpatient care. When done well, patients feel informed and confident about their treatment. When it's not, misunderstandings can lead to anxiety, medication errors, or poor adherence once patients go home. Older adults face unique challenges, sensory or cognitive changes, and the complexity of multiple medications. Yet, despite this, hospital communication often doesn't meet their needs. Many patients report leaving hospital unsure why their treatment changed, or feeling left out of those decisions entirely. That lack of understanding affects more than confidence. It impacts trust, satisfaction, and health outcomes. That's why I wanted to explore in depth how older patients and their carers perceive these conversations, what works, what doesn't, and how communication could be improved. To explore this, I used a qualitative design, specifically semi-structured interviews. These allow for guided yet flexible conversations where participants could share experience in their own words. Rather than sticking to a rigid questionnaire, I adapt questions naturally, encouraging participants to reflect and elaborate. The study took place in a district general hospital in the UK, across 4 wards specializing in the care of the older adults, the ideal setting to observe inpatient communication practice. I used purposive sampling to recruit participants who could offer rich insights. Older adults aged 65 and over, and their carers involved in medicine management. In total, I conduct 10 in-depth interviews, some with patients, some with carers, and some involving both parties together. Interviews took place privately or at the bedside, depending on comfort. All participants gave informed consent. Each interview was audio recorded, transcribed, and analyzed using thematic analysis. By carefully coding and comparing the transcripts, I identified key patterns and recurring ideas. This process revealed how patients and carers truly experience and perceive communication about medication changes during hospital stays. From this 10 interviews, 5 key themes emerge, offering a detailed picture of communication challenges and successes. Theme 1: Inadequate communication around medication changes. Our first theme highlights a widespread issue. Patients and carers frequently experience inadequate communication regarding medication changes. Many describe receiving little to no information, which led to confusion and uncertainty. Without clear guidance, both patients and carers felt left in the dark, unsure why changes were made, what to expect, and how to manage the new regimen. A patient shared, "When I left, they gave me a bag full of medications that I didn't recognize. They were completely different, all new. No idea what they are actually for." Theme 2: Desire for clear and timely communication. Building on that, Theme 2 reflects a strong desire for clearer and more timely communication. Patients and carers consistently express that simple, direct explanations at the start of a medication change made a significant difference. They value understanding the rationale behind decisions, why a change was necessary, what benefits it might bring, and what risks to consider. This clarity not only improves satisfaction, but also helps them accept and engage with treatment. A patient explained, "You will have to come up with some good reason why I should take it. I would wait until I felt happy with what he said, and then I would say alright." Theme 3: Communication builds trust and supports adherence. Theme 3 explores how effective communication fosters trust and promotes adherence. When explanations were lacking, patients and carers become skeptical, leading to distrust in the treatment process. They rely heavily on the expertise of healthcare professionals, but gap in knowledge made it difficult to fully understand their medication regimens. Side effects and the burden of multiple medications further complicated adherence, especially when these issues weren't openly discussed. A patient asks, "Just tell me, are there any really bad side effects? Are they addictive? Some painkillers are, aren't they?" Theme 4 Exclusion from Decision Making. Theme 4 reveals that patients and carers often feel excluded from decisions about medication. Limited involvement led to frustration and a sense of being sidelined. There was a strong desire for shared decision making, being presented with options, having transparent discussions, and understanding the expected outcomes. This collaborative approach was seen as essential to feeling respected and informed. A patient reflected, "I love to feel part of the decision, not to be told because I have had a lot done to me. So I am quite body aware. Doctors that involve me in the decisions I respect far more than the one who tell me." Theme 5 The vital role of carers in supporting older patients. Finally, Theme 5 focuses on the vital role carers play in supporting older patients. Carers actively sought information to fill gaps and advocate for the needs of those they care for. Their input was not only valuable but often essential to ensuring informed, collaborative decisions. Involving carers in the medication discussions led to better outcomes and more personalized care. A carer shared, "I think it always matters that you are involving the patient and the families as well. Because in theory, the doctor could have a form of action, but actually, that's not what mums want." This study shows that older patients and carers often feel uncertain or excluded when medications are changed in hospital. They want to understand the reasons and to be included in decisions that affect them. They don't want to be passive, they want to be partners. They want open, respectful conversations that acknowledge their experience and perspective. This finding echoes previous research showing that poor communication and time pressures leave patients with unanswered questions. But my study adds something new. It shows how quality of communication, not quantity, shapes trust. It also highlights how carers quietly bridge the gaps in understanding. So, what does this mean for practice? First, healthcare needs to be more patient-centered in communications. That means using simpler language, visual aids, or written summaries, and giving space for questions. Shared decision-making should become the norm, not the exception. When patients and carers understand their options, confidence and adherence both improve. Healthcare staff should receive training on communication strategies tailored to older adults. How to explain complex changes clearly, when to slow down, and how to meaningfully include carers. Pharmacists and nurses can play a bigger role here. Their accessibility makes them key allies in supporting patients through medication changes, during walk rounds, discharge planning, and follow-up. At a policy level, hospitals should implement structured medication reviews that include patients and carers, especially during discharge. This consistently reduces errors and supports safer transition homes. In summary, this study highlights a simple truth. Communication is care. When explanations are clear and patients are included, trust and adherence grow. When they are not, confusion and anxiety follow. To truly deliver patient-centered care, we must move from one-way instruction to genuine collaboration, where patients, carers, and professionals share understanding and responsibility. Improving communication isn't just a soft skill, it's a safety issue, a trust issue, and the foundation of compassionate care. By involving carers, empowering pharmacists and nurses, and embedding shared decision-making into daily practice, we can build a healthcare system that not only treats illness but listens, respects, and truly cares for the patients behind every prescription. The takeaway is simple. Talk with patients, not at them. Explain, listen, involve, collaborate. Because when communication improves, care improves. Thank you for watching.